Assalamualaikum everyone. My name is Dr. Rida Shehram Sarwar, and under the supervision of Professor Dr. Saira Iqbal Afzal, I will be presenting today, and my topic for today is budgeting in health services. Quote for today is, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. And this is by Martin Luther King Jr. Our learning outline is introduction, budgeting in healthcare, definition, need, types, approaches, procedure, as well as challenges. Learning outcome is that at the end of the presentation, participants will have a broad overview of the importance of budgeting in health services, the need for it, its different types, along with the challenges faced when allocating a suitable budget for the health services in a country, paying special attention to Pakistan. Introduction. Public health expenditure, a component for the provisioning of health facilities. Definition. Recurrent and capital spending from government budgets, external borrowings, and grants and social health insurance funds. Financial control in health settings. Proper accounting systems for funds, equipment, laid down standards of performance against which actual performance should be measured, as well as the tools of control include budget, hospital cost control, and financial statement analysis. The definition of which is a statement of future plans described in a quantitative and monetary terms for a specific period of time, which is usually 1 year in case of financial budgets. Need for budget. The need for proper budgeting arises to allocate scarce resources to various government activities, which include planned expenditure and accurate foresight of earnings, and has to be based on the long-term strategy and focus on the future. All healthcare professionals should have a sound knowledge of budgeting and healthcare financing. Types of budget include time-based budgets, function-based budgets, flexibility-based budgets. Time-based budgets include long-term, short-term, current, rolling, and function-based include capital-based, operational, research budgets. Flexibility budgets Base budgets include fixed budgets and flexible budgets. Approaches to budgeting in healthcare include incremental performance and zero-based budgeting. Incremental approach. This includes previous year's expenditures applied to the next year with additional components. Only the increment over the previous year's budget is actually justified for the present duration. Advantages include easy to prepare, less preparation time, and lower preparation costs. Easy to understand and prevents conflict. Disadvantages include wasteful expenditures and priorities are not ascertained. Alternative better options are not considered. Performance budgeting presents the actual operations undertaken department-wise and evaluation of actual performance of the organization. Periodic performance reports is prepared which compares the budgeted actual performance with the aim to detect any deviations at the earliest possible. Zero-based budgeting must review the existing and old programs, especially which involve a high degree of discretionary cost justification that the activity proposed is essential, cost-effectiveness is required. No activity or action is financed simply because it was done in the past, and the entire program must be justified each time a budget is being drawn up. Advantages of zero-based budgeting include based on cost-benefit analysis, strictly based on priority. So programs, actions identify areas of wasteful expenditure, and limitations include planning requires greatest effort and time, less applicable for those activities which do not have a direct cost-benefit relationship. Advantages of budgeting in general include this is an effective means of communicating future organizational plans to all people in monetary and financial terms. Pre-decided and approved budget service is an effective benchmark for monitoring ongoing operations. Reduces wastage and losses by identifying wasteful expenditures well in advance and rectifying them. Budgets through participation encourage and develop team spirit and collective responsibility towards excellence. Basis for assessing performance of senior managers in any organization. What is a budget in healthcare? A healthcare hospital budget is an estimation of revenue and expenses over a specified time period. Through the healthcare budgeting process, health systems come to an understanding of how much funding must be planned in certain areas, including operating costs and capital equipment. A health system may include hospitals, physician groups, skilled nursing facilities, home care services, foundations, and a variety of other business types. During the budgeting process, leaders must account for key components of planning in healthcare, including volume growth assumptions, feedback, and input from key stakeholders and the ability to adjust when inputs and circumstances change. Ultimately, a well-planned budget allows health systems to plan appropriately for the future in order to provide quality care. The types of budgeting in healthcare organizations include operational budgeting, which is the process of determining the funding planning for facility operating costs and personnel costs, such as staffing and training. Staffing is usually the largest cost in a healthcare operational budget and must not only account for fixed costs like salaries, but overtime hours, potential overstaffing, and other variable costs. The healthcare operational budget allows hospitals and health systems to monitor and balance revenues and expenses. Capital budgeting in healthcare is the process of allocating funds to the purchase of durable goods such as beds, equipment, or improvements to the building or infrastructure. A hospital capital budget is important because the purchases made from the pool of resources, example, more surgical equipment or updated technology, can have a direct impact on the health system's ability to provide better care to the patient. Capital budgeting in healthcare is generally related to the hospital or health system's overall strategic vision for the organization. When comparing an operational budget to a capital budget, it is important to note that while two are separate, each influence the other. Capital investments such as new facilities or updated technology can impact future staffing and operating costs. Funding for those purposes, however, may come to need from the operational budget. When planning hospital budgets, leaders must balance the effects of the two budgets. Rolling forecasting, which in healthcare is a process of healthcare leaders to update their financial projections on a monthly or quarterly basis. This process uses historical data to continuously update near and long-term projections. With frequent updates, leaders can adjust their strategy and conditions change. By utilizing rolling forecasting, healthcare organizations can plan more efficiently and make agile, data-driven decisions. Why is budgeting so important in healthcare? Healthcare is a rapidly changing industry that must continuously adapt as new patients emerge, technologies and techniques are updated, and reimbursement models evolve. A strong healthcare budgeting process allows leaders to plan for the future and establish priorities around care and clinical departments. A healthcare budget is an important tool to understand where funds are best spent and how to allocate capital among various departments and projects. This enables healthcare organizations to be more efficient in delivering effective and efficient patient care. What are the benefits of budgeting in healthcare? Healthcare budgeting is critical for decision-making process across health systems and organizations. An effective budget process allows healthcare leaders to align operational plans with financial planning targets, prioritize capital investments to align with strategic initiatives, effectively manage capital spent and cash flow, better understand the amount of funding to individual projects, initiatives, and clinical departments, as well as minimize purchasing errors. What are the budget-related challenges which hospitals face? Because of the rapidly changing nature of healthcare industry, health systems and hospitals face many budget-related challenges, including unpredictable economic events such as 2020 COVID-19 pandemic, which can render a static budget outdated and inaccurate. Changes to reimbursement and payment models, including declines in the Medicare and Medicaid reimbursement, development and adoption of new technologies such as telehealth and home-based medicine, labor shortage and increasing costs, mergers, acquisitions, and increasing market competitions from new care delivery methods, supply chains and interruptions such as personal protective equipment or prescription drug shortages. What factors affect healthcare budget? Beyond factors within a healthcare system control, a variety of factors can affect the healthcare budget, including changes in patient volume across various departments, which can affect service line budgeting, rising interest rates, inflation, higher capital acquisition costs. The budgeting process in healthcare. The process of healthcare budgeting differs from based on your planning approach, be it traditional budgeting or rolling forecasting. The traditional budgeting healthcare process typically involves budgeting software that incorporates historical data, inputs, and assumptions. Healthcare leadership reviews relevant data in the system from across clinical services and departments. The budget is then routed for input, updates, and approval from a variety of stakeholders. Ultimately, this process results in a budget that applies to a static period of time, such as a calendar year of January 1st to December 31st. Rolling forecasting is a planning approach that allows healthcare leaders the flexibility to use historical data to predict future performance. Essentially, it answers the questions: how has the previous month or months changed over the view of the present and future? Unlike a traditional budget, which is based on static annual data, rolling forecasts use current data to update near and long-term projects. Based on rolling forecasting, leaders can quickly adjust strategies such as financial condition change, examine current expenditures and initiatives, and make strategic decisions about future endeavors. Healthcare financing within the health system. Financing is a function of the health system concerned with the mobilization, accumulation, and allocation of money to cover the health needs of the people individually and collectively. The purpose of health financing is to make funding available as well as to set the right financial incentives to providers to ensure that individuals have access to effective public health and personal health care. A good health financing system raises adequate funds for health so that people can use needed services protected from financial catastrophe or improvement or impoverishment associated with having to pay for them. Provides incentives for providers and users to be efficient. The approaches that countries use to finance their health systems varies. There are variations in provision of health resources those systems need and important institutional arrangements that create economic incentives in the operation of health systems. All health financing approaches should fulfill three basic principles of public finance. Number one, raise enough revenues to provide individuals with intended packages of health services that ensure health and financial protection against catastrophic medical expenses caused by illness and injury in an equitable, efficient, and financially sustainable manner. Manage these revenues to pool health risks equitably and efficiently and ensure payment for purchase of health services is carried out in ways that are allocatively and technically efficient. Pakistan is spending far less on healthcare than WHO recommended amount. According to figures released in the Economic Survey of 2021, the country is spending a meager 1.2% of its GDP on healthcare, while the WHO has recommended 5% of the GDP to be spent on the sector. However, the figure is slightly more than 2017 to 18's 1.2% of GDP. The cumulative health expenditure by the federal and provincial governments went up to 14.35% from 41.78 billion last year to 42.27 billion this year. During the current fiscal, the federal government has allocated 20.194 billion for 71 health projects under public sector development program. As far as health projects go, government introduced a rupees 70 billion healthcare program to mitigate the impact of COVID-19 pandemic by upgrading health facilities, sewerage system, solid waste management, drinking water supply, and education. The country's health indicators continue to record improvement. Pakistan health system faces challenges generally including limited human resources, poor health infrastructure, fragmented procurement mechanisms, and an unregulated private sector, weak health information systems, and frequent health emergencies. The country's universal health coverage index is 45 out of 100, and the National Health Vision 2016 to 2025, Pakistan pledged to increase federal and provincial allocations of to health to 3% of the GDP and identified better coverage and more functional primary health care services such as strategic priority for the federal and provincial governments to achieve UHC. However, Pakistan's current health spending is 3% of the GDP, well below the World Health Organization's recommended that a country should spend at least 6% on healthcare. According to the proposed budget for 2022 to 2023, rupees 12.7 billion will be allocated to public healthcare services, a decrease from the estimated rupees 3.3 billion allocated in 2021 to 2022 period. Steps in budgeting include look at your detailed work plan, list all the activities, purchases, personnel which consume finances, cost the activities, prepare the item budget, sum up the line item budgets into a master budget. Recent advances. Budget makers in healthcare systems, abstract health programs are shaped by decisions made in the budget process. So how budget makers view health programs is an important part of making health policy. Budgeting in any country involves its own policy community with key players included budgeting professionals and political authorities. This article reviews the typical pressures on and attitudes of these actors when they address health policy choices. The worldview of budget professionals include attitudes that are congenital to particular policy perspectives, such as the desire to select packages of programs that maximize population health. The pressures on political authorities, however, are very different. Most importantly, public demand for healthcare services is stronger than for virtually any other government activity. Is there any general theory for healthcare budgeting? Abstract. This article suggests the broad theoretical framework is needed within the empirical evidence about the results of the many different healthcare funding systems that can be analyzed. A possible framework is described. The article also proposes that when policymakers select the budgetary system most likely to produce the patterns of healthcare that are required, They should install output and quality controls designed to avoid any predictable and undesirable side effects. Reimbursements under the budget could be made conditional upon an adequate performance, such as measured by the controls. MCQs. Question number 1. Pakistan's healthcare system faces several challenges, including limited human resources, poor health infrastructure, fragmented procurement mechanisms, and unregulated private sector, weakened health information systems, and frequent health emergencies. The country's universal health coverage index is A 50 out of 100, B 60 out of 100, C 45 out of 100, D 70 out of 100, or E 100 out of 100. The answer is C, 45 out of 100. Question 2. The primary role of financial management in healthcare organizations is to manage what to achieve the financial goals of the organization. A. Human capital and the supply chain. B. Social branding and marketing. C. Money and risk. D. Information technology and security. Or E. Business and finance.
A.
Yes, the answer is A. Question 3. Operational budgeting in healthcare is the process of determining the funding plan for facility operating costs and personnel costs. What is usually the largest cost in a healthcare operational budget? A. Staffing. B. Training. C. Equipment. D. Labor. Or E. None of the above.
A.
Yes, the answer is A. Question 4. What type of budgeting in healthcare is the process of allocating funds to the purchase of durable goods such as beds, equipment, or improvement to buildings or infrastructure? A. Operational budgeting. B. Capital budgeting. C. Rolling forecasting. D. Performance-based budgeting. Or E. Personnel budget.
A.
The answer is B. Question 5. A medical audit committee comprises professionals from different departments of a hospital. Which of the following may act only as observer in the committee meetings? A. Head of medical departments. B. Nursing superintendent. C. Head of pathology. D. Director of medical services. Or E. Admin.
E.
Yes, the answer is 5E. Question 6. A hospital is a vital organization and stands unique and incomparable to any other organization. Which of the following is considered important part of new hospital plan, not only for aesthetics and access, but also utilize the potential to capture or avoid natural energy? A. Provision for disasters. B. Functional requirements. C. Future expansion. D. Environment impact analysis. Or E. Siting and orientation.
D.
E. 7. A healthcare or hospital budget is an estimation of revenue and expenses over a specified time frame. Budgets are classified on the basis of A. Capacity, B. Time, C. Functions, D. Flexibility, or E. All of the above.
Could be E.
Yes, it's E. 8. Pakistan is spending far less on healthcare than what is recommended by WHO. According to figures released in the Economic Survey of 2021, the country is spending a meager 1.2% of its GDP on healthcare, where WHO has recommended what percentage of GDP to be spent on that sector? A. 5%, B. 10%, C. 20%, D. 0.2%, or E. 85%.
5% A.
Yes, the answer is A. 9. Based on rolling forecasts, leaders can quickly adjust strategies as financial conditions change, examine current expenditures and initiatives, and make strategic decisions about future endeavors. Unlike a traditional budget, which is based on static annual data, rolling forecast uses what type of data to update near and long-term projections? A. Secondary data. B. Current data. C. Binary data. D. Past records. Or E. Structured data.
A.
B. Current data. Question 10. Which of the following statements describes the functions of a budget? A. It is a description of the income and expenditure of a government. B. It is a document containing details of the economic policy of a government. C. It is a description of the programs of a government, be a healthcare hospital budget is an estimation of revenue and expenses over a specified time frame, or E, all of the above.
E.
Yes, the answer is E. This is the key. These are my references, and this is the link to the YouTube channel. Thank you,
Dr.
everyone.
Rida, can you stop the recording?
Okay.